Chapter 1. Introduction to Substance Use in Primary Care. Welcome to this foundational chapter on substance use in primary care. In this segment, we explore the growing challenges and responsibilities that primary care professionals face in addressing drug misuse. We will cover the prevalence of substance use in the UK, its deep connections with trauma and deprivation, and why primary care is uniquely positioned to make a meaningful difference. Additionally, we will discuss the importance of clinical guidance, the risks of polydrug use, and the various screening methods used to identify drug misuse effectively. Substance misuse is a significant and growing public health issue across the United Kingdom. Over the last few decades, there has been a marked increase in the number of people who use substances problematically. This includes not only illicit drugs such as heroin and crack cocaine, but also the misuse of prescription medications, over-the-counter drugs, and novel psychoactive substances. Furthermore, the patterns of use are evolving, often involving the concurrent use of multiple substances, a phenomenon known as polydrug use. What makes this issue even more complex is its strong association with social deprivation and trauma. Adverse childhood experiences, often referred to as CEs, play a crucial role in the development of substance misuse problems later in life. These can include experiences such as domestic abuse, neglect, and parental substance use, or mental illness. Individuals exposed to these circumstances are significantly more likely to turn to substance use as a coping mechanism. Social deprivation, including factors like poverty, unemployment, lack of stable housing, poor access to education, further increases vulnerability. Substance use, in turn, often perpetuates this cycle, contributing to continued social marginalization and health inequalities. Primary care plays a critical role in addressing these complex and interwoven issues. Unlike specialist drug services, which individuals may or may not access depending on various barriers, primary care services are more broadly accessible and often serve as a first point of contact. This accessibility gives primary care providers a unique opportunity to identify and intervene in substance misuse cases early on. However, to make the most of this opportunity, healthcare professionals must be equipped with the knowledge and tools to recognize the signs of substance misuse and respond appropriately. Holistic care in the context of substance misuse means looking beyond the immediate drug use to consider the broader health and social needs of the individual. This involves screening for bloodborne viruses such as HIV and hepatitis B and C, as these are more prevalent among people who inject drugs. Vaccinations are another essential element. Offering immunization against hepatitis B, for example, can significantly reduce long-term health complications. Managing chronic diseases such as cardiovascular disease, diabetes, and mental health disorders is equally important, as these are often neglected in people who use drugs due to stigma or lack of access to care. Another critical component of holistic care is building and maintaining trust. Many individuals with substance use problems have had negative experiences with the healthcare system, feeling judged or dismissed. In primary care, a non-judgmental, compassionate approach can go a long way in engaging patients and encouraging them to participate in their own care. Establishing continuity of care through regular follow-ups and creating a safe space for open dialogue are essential strategies in building that trust. To ensure that interventions are effective, primary care providers must follow up-to-date clinical guidance. National guidelines, such as those published by NICE, provide evidence-based recommendations on how to manage substance misuse in various healthcare settings. These include best practices for opioid substitution therapy, detoxification protocols, and managing co-occurring mental health issues. Adherence to these guidelines not only improves outcomes for the patient, but also provides legal and professional protection for the clinician. One of the most pressing challenges in managing substance misuse is polydrug use. This refers to the concurrent use of more than one type of drug, often in dangerous combinations. For example, the combined use of opioids and benzodiazepines significantly increases the risk of fatal overdose due to their synergistic effects on respiratory depression. Similarly, mixing stimulant drugs like cocaine with depressants such as alcohol can mask the effects of each drug, leading individuals to take higher, riskier doses. Understanding the dynamics of polydrug use is crucial for effective treatment planning. A thorough patient history must be taken to identify all substances being used. This includes asking about both prescribed and non-prescribed medications, alcohol, and tobacco use. Screening tools such as the Alcohol Use Disorders Identification Test, the Drug Abuse Screening Test, and other validated questionnaires can be extremely helpful. These tools help to identify the severity of substance misuse and guide appropriate intervention strategies. Importantly, screening should not be a one-off event. Substance use patterns can change over time, influenced by life events, stress, and changes in mental or physical health. Ongoing assessment is therefore essential and should be integrated into routine care wherever possible. This also provides opportunities to revisit conversations about treatment options, harm reduction, and recovery planning. Primary care teams should also be aware of local referral pathways to specialist services, social care, and community support organizations. Establishing strong working relationships with these services can greatly enhance the support available to patients. For example, a patient identified in a GP clinic as having problematic drug use can be rapidly referred to a local drug treatment service. For a comprehensive assessment and intervention plan, timely referrals are especially important for individuals at high risk of overdose or those with complex social and medical needs. Multidisciplinary collaboration is another cornerstone of effective substance misuse management. GPs, nurses, mental health professionals, social workers, and addiction specialists all bring different expertise to the table. Regular case conferences or care planning meetings can help ensure that care is coordinated and responsive to the patient's changing needs. This team-based approach not only improves clinical outcomes, but also provides valuable support to healthcare professionals managing challenging cases. In summary, the role of primary care in managing substance misuse cannot be overstated. With its wide reach, potential for early intervention, and capacity for holistic care, primary care serves as a frontline defense against the escalating public health crisis of drug misuse. To fulfill this role effectively, primary care providers must be vigilant, compassionate, and well-informed. They must be prepared to screen for substance misuse regularly, understand the complex web of social and psychological factors that underpin it, and engage patients in a collaborative, non-judgmental manner. Staying informed about the latest clinical guidelines, maintaining strong referral networks, and adopting a team-based approach are all essential components of best practice. Through these strategies, primary care can not only help individuals reduce or stop their drug use, but also improve their overall health, well-being, and social inclusion. This holistic, person-centered approach is the key to breaking the cycle of addiction and creating pathways to recovery. In the chapters to come, we will delve deeper into the clinical assessment of substance use, explore pharmacological and psychosocial treatment options, examine case studies that illustrate the real-world application of these principles. But for now, let this serve as your introduction to a critical area of healthcare, one that holds the promise of transformation, not only for individual patients, but for families and communities as well.